What are the signs of heart attack? A heart attack is one of the common medical conditions that we experience in our lives. It is mostly seen as a part of our life, and sometimes we see one of our family members suffering from a heart attack. There are certain signs and symptoms of a heart attack which include the following. Insomnia and anxiety are associated with heart disease because in this condition, the blood flow is inappropriate, leading to a reduced oxygen supply. It can be considered as one of the early signs of a heart attack, where you might suffer from chest pain or pressure within the chest area. Discomfort and painful sensations are a part of a heart attack where you suffer from radiating pain within the chest that moves towards the neck, face, and jaw area. You might also feel pain within the shoulders, hands, throat, or upper abdomen. You'll experience mild tingling and numb sensation within the chest area and other parts of the body, which serves as the initial sign of heart attack. A clenching feeling or chest pain is considered as the sign of heart attack where the cardiac artery is blocked. The patient feels chest pressure along with a crushing pain and heavy feeling lasting for a few minutes to half an hour. If you suffer from chest pain for only a few seconds, then it is not the sign of a heart attack. Intense sweating is considered as a sign of a heart attack, and it is seen in many patients of people who suffer from a heart attack have a pallor face with profuse sweating. Patients suffering from heart attack lead to the activation of the sympathetic nervous system, which is the reaction of the body to lower blood pressure and painful sensations. Any patient who starts sweating a lot without performing any intense physical activity is most likely suffering from a heart attack. Breathlessness or shortness of breath can occur in a patient suffering from a heart attack due to the stressful impact over the heart. This condition is termed as dyspnea, which is the initial sign of a heart attack. It indicates that the body needs rest and that the heart is unable to pump efficiently without proper filling or emptying. Eventually, it leads to an increased blood pressure due to the buildup of fluids surrounding the lungs. Pooling up of fluids can result in the swelling of the ankles, insomnia, breathing difficulty, weight gain, weakness, and fatigue. Heart attacks can also result in stomach indigestion or stomach pain. We usually consider stomach pain as a sign of the GIT issue, but it can also be an indicator of a heart attack. It is better to avoid any delay in the treatment and consider the symptoms immediately, as reduced blood supply towards the heart and blockage of main arteries can cause angina. Irregular or abnormal heartbeat is also one of the leading signs of a heart attack. Irregular and rapid pulse in this condition can lead to heart attack, which is accompanied by fainting and dizziness. People usually misidentify the case and consider irregular heartbeats as the sign of a panic attack rather than visiting their doctor immediately. Exhaustion and extreme fatigue is also the sign of a heart attack, which shows that you are suffering from underlying heart diseases. It is more commonly visible in cases where you are performing a similar physical activity which you did previously and felt fatigued or are unable to complete it appropriately, leading to exhaustion. This sort of tiredness is the sign of heart diseases where the heart is unable to pump efficiently throughout the body.